Hello and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Now, according to the most recent National Health and Morbidity Survey, 1 million Malaysians aged 15 and above are suffering from depression, with half of them harboring thoughts of self-harm or thinking they were, quote, better off dead, unquote. Now, equally concerning is that data also reveals that the mental health problems among children have more than doubled since 2019, now affecting 1 in 6 children. Now, as we delve into these findings, we must ask ourselves, how can we translate this data into effective national policies that go beyond addressing awareness and stigma to ensure that robust institutional support and comprehensive care for mental health. Now, joining us on the show to discuss this further is Associate Professor Dr. Amer Siddiq Nordin, who is a consultant psychiatrist at Universiti Malaya. Thank you so much, Dr. Amer, for joining me on the show today. Just to recap that the National Health and Morbidity Survey found 1 million Malaysians suffering from depression. I want to get a sense from you. Help us understand what this means, the significance of this finding in the context of Malaysia's overall mental health landscape, and especially the part where the severity of the mental health crisis, with nearly half of these respondents contemplating self-harm.
So thank you again, Melissa. It's really nice to see you again online and being with Consider This. So I think you've really hit the nail on the head, whereby we're really discussing about something that's really crucial. I mean, we've talked about this over the last few years, actually, that there appears to be a trend. And now with the National Morbidity Health Survey, we're seeing that trend actually being manifested as we thought about. So you're right, the adult prevalence has increased from 2.3% in 2019 to 4.6%, which means that it's doubled. The number of individuals that have reported struggling with depression has doubled. And as you mentioned just now, among children also, this number has more than doubled, which I think both numbers are concerning, but not very surprising. And I think the way that we look at it is that it also means that there's a few things it means. One is that the impact of COVID over the last few years has definitely played its toll. The second thing is that it also validates what we're all saying and seeing and discussing over the last few years, that yes, there is an increase in mental health issues, and now we're seeing the numbers in a very common, treatable, but at the same time important medical problem called depression has also increased. And I think this is where we really need to start thinking about what we're going to do about it moving forward.
Okay, so how do we think about that? Now we understand this is a trend and we have to do something about it. We can predict what will happen if we don't do anything about it. So what would you say is necessary to integrate mental health care into Malaysia's public health policies and maybe ensure it receives, the same level of attention and resources that physical health gets?
Well, I think the most important thing, as you've also mentioned just now, is that if you don't treat individuals with depression and other severe mental illnesses, then the risk of individuals having premature death increases, particularly in terms of suicidal actions and attempts. And I think the number of individuals that have reported feeling this way has also, as you rightly mentioned, quite scary in number. So, I mean, there's a number of things that we really need to do. We really need to look at it from a systems approach. Issues with prevention needs to be upgraded. But at the same time, for those who are struggling with depression and other mental illnesses, access to treatment must be made available, affordable, and highly accessible. And this is where, with technology at the moment, we can probably do this. But I think what's more important is that we need to be proactive rather than reactive. We know that this trend is increasing. We know that these numbers are increasing. You hear a lot of complaints on social media, particularly about individuals still struggling to access health, particularly in certain areas of our country. It's not exactly equal for everyone in this country in accessing health. And I think that needs also to be addressed. When you're accessing health as well, mental health care does not just include people like myself, psychiatrists. They include a whole number of people like psychologists, counselors, social workers, specialized nurses in psychiatry, for example, and a whole bunch of other people, including the non-governmental organizations. And we really need to start looking at them as a whole rather than individuals, because when we're dealing with health as complex as this, it needs a team approach. But if your numbers are small among your, say, clinicians, even smaller among your support, we often hear about complaints about people having trouble accessing clinical psychologists, for example, then definitely there is going to be a problem when these individuals access this health. Then the third one, of course, is once they've accessed healthcare, what next? How's the support in the community going to be in terms of assisting them to maintain good mental health once they've already been assessed, diagnosed, treated? Then what next? So I think this is where we really need to think about it in that approach. Also, as you rightly mentioned, there are many layers of individuals that will be struggling: children, adults, working adults, and also the elderly. And if you don't know familiar that in the next few years, we're expecting that about 15% of Malaysians will be elderly. And we know that about a third of these individuals might have an increased risk of developing depression, especially if they have chronic medical conditions. So these are the kind of things that we really need to think about before the next NMHS survey comes out, and we hope that the data doesn't show an upward trend.
Right. Dr. Amer, can you elaborate? So when you talk about access to treatment and the need for there to be a robust ecosystem to support that access to mental health care, what is it currently? Maybe you can describe what it is currently, and what would success look like in terms of accessibility to treatment?
Well, I think to be fair to the Malaysian healthcare system, we're actually doing really well. Number one, we have universal healthcare, which means that all Malaysians have access to health. We have a public and private healthcare system, which is fairly equal. Individuals that have the means can access who they want to see. But at the same time, individuals who might not have the means, the public healthcare system allows them to be seen and treated. Of course, there's a difference in terms of waiting time and maybe accessibility to certain doctors or services that they want. But in general, everyone is allowed to get the right health care in this country. I think what we still struggle with is that certain areas of the country might have an excess of resources in terms of the medical healthcare team. They might have the full lot, the psychiatrists, the psychologists, the counselors. And then there's going to be some areas of our country that you might have just a psychologist, just a psychiatrist, or just a counselor, or you might have one or the other or all of them, but in very small numbers compared to the population that there's going to be addressing. And of course, there's going to be certain populations that you won't have them at all, and then you've got to have visiting professionals coming into those communities, which means that to get access to that health system is not going to be as quick as one would like it to be. And as you mentioned just now, one of the major risks for some of these medical conditions like depression, for example, schizophrenia and bipolar, if these individuals are unwell, the risk of harm to themselves is increased. And therefore, urgent needs to get health care is actually quite important. So when you have areas that might not be able to access it as quickly, then of course there's going to be a problem with access. Then of course the second one is about what's available for individuals to be treated once they have been noted to have a medical problem. The treatment that's available, we often look at it from a biopsychosocial, spiritual, lifestyle point of view. But if all you have is medication and you don't have the support, then you're unable to give a holistic health system to these individuals that might need it. And then, of course, like I mentioned, some places will get that whole system and the others might not. So this is the kind of issue that we are dealing with when we talk about accessibility at this point of time.
I'm also curious to learn more about how you see the intersectoral collaboration needed to ensure that we stem this trend of mental health care decline, or even reverse it, the idea that mental health intersects with various sectors. You've got poverty, employment, education, housing, interpersonal relationships, all of that. And I'm wondering, how do we think about that from a national policy level? Are those can we address some of those broader determinants of mental health through policy interventions?
Well, definitely, certainly. I'm not sure whether you're aware that about 3 weeks before the National Morbidity Health Survey came out, there was a youth mental health index that was launched by Ministry of Sports and Youth, where the Ministry of Health was also part of that particular ecosystem, and in that index, they looked at a number of areas that definitely would affect young people's mental health, and it's going to be the same for mental health in general, and it's going to be what you've just shared, basically the social determinants of health, how the environment affects individuals' health, how access to literacy, for example, improves or declines health. Issues with regards to employment, isolation, or social connections, for example, definitely would affect. So it's the same thing as you mentioned, whereby in terms of mental health, it's not just the Ministry of Health that is involved and plays a role. It's actually all of us in every sector that plays a role. So there is something called the Mental Health Promotion Advisory Council that sits about 1 to 2 times a year, where the various agencies and ministries in the country would sit in together with non-governmental organizations, certain members of civil society, and they will try to discuss and deliberate how we might improve the intersectoral connections. At the moment, there's lots of discussions, and these discussions have been happening over the last few years, but it takes definitely a lot of effort. But slowly, I think, Melissa, that things are moving in that direction, especially with these numbers that we've seen, which shows that there more needs to be done. And I think what we can be at least a little bit happier with is that it's still below what the WHO is stating, 5%, but definitely a lot more can be done. And I think the fact that we are at least thinking about it, discussing about it, means that we can do something about it moving forward. But I think we need to move forward faster, and we need to move forward more aggressively. The ideas that we're having at the moment needs to be innovative, creative, and I think more urgent in the way that we develop things. And I hope that over the next few months, we'll be seeing some of those efforts being put across, because, as you mentioned, we are quite concerned about these numbers.
Well, Dr. Amer, always a pleasure talking to you. Thank you for your time. That was Associate Professor Dr. Amer Siddiq Amer Nordin, Consultant Psychiatrist at Universiti Malaya. We're going to take a quick break here and consider this. We'll be back with more. Stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our discussion about the findings from the recent National Health and Morbidity Survey that found over 1 million Malaysians aged 15 and above are grappling with depression. Nearly half of them have contemplated self-harm. Now, joining us on the show to discuss this further is Farihin Ufiya, who is the director of the non-profit Mental Health Aid Association, better known as Nyawa. It's a strategic partner to the Ministry of Health. Farihin, thank you for being on the show with me today. Can I get your initial thoughts on the findings of the recent survey? What was most concerning to you about the state of Malaysians' mental health based on the findings of the National Health and Morbidity Survey?
Okay, thank you so much, Melissa. So I think 2 key highlights are that it's increasing rapidly, mental health issues, doubling in prevalence in just 4 years, and that it affects the younger age groups most. So 1 in 6 children aged 5 to 15 years old experience mental health problems, which is heartbreaking. So to me, the government funding policy already acknowledges this disproportionate severity in mental health problems in younger population. For example, Yayasan Hasana's priority areas include mental health interventions in schools specifically. So this means that they're already targeting school-age children. These programs are usually school-based interventions in the form of screenings, workshops, counseling, which is commendable. But the trends showing higher prevalence with lower age group and increasing prevalence each year suggests that this is a modern epidemic, and modern problems require modern solutions.
Right. Let's talk about the modern problems. I want to ask you about the impact of social media, particularly on young girls. Not limited to just young girls, but the impact may be disproportionately bigger on young girls. How significant would you say, based on your work, is the impact of social media on young people in Malaysia? And when you say modern problems, modern solutions, what policies might help mitigate some of these negative effects on mental health of young people?
Okay, so first I'll answer the first part of the question. How does social media affect young people? And studies have been consistently showing that it affects youth mental health for sure, especially with regards to their self-esteem and confidence and self-image. And this, of course, affects young women disproportionately. Of course, even the user base for most of these apps like TikTok and Instagram are disproportionately women, and women are more vulnerable to image-based self-criticism. So what worries me is actually the AI boom. And when I speak of modern problems requiring modern solutions, I think currently a critical priority should be enacting policies in tandem with the development of AI to protect our children's mental health, because we're already blindsided by AI's progress. This policy could look like regulating AI companies, labeling generated AI content. In fact, UNICEF has an entire guideline on AI safety policies for children. But on a similar note, the public sector also has not even leveraged basic technologies to make mental health services more efficient and affordable. I'm a strong advocate for automating the technical aspects of psychotherapy, so appointment scheduling and screenings, but such efforts have not been adequately supported by our government, which may be to our detriment soon. We're allowing global technologies like Instagram and TikTok to affect our children's mental health, but we're not harnessing that same algorithmic power to attempt at combating these problems. Instead, we're just like running child awareness campaigns and making posters about self-care. It's like bringing a knife to a gunfight. And with AI, soon the guns will be nuclear weapons.
Right. That's interesting. I want to also think about how these public mental health care campaigns can move beyond just addressing self-care, addressing awareness of mental health. How do we move beyond that very preliminary first step of addressing mental health to now and to more kind of robust framework of support, Farihin?
Okay, so there are two aspects of it, I guess. The first would be the more medical health-based intervention, and one, the more social-based interventions, right? So let's talk about the health-based interventions first. And it's about making sure that not only people are aware, because right now, especially younger people are very much aware. From our work at Nyawa, a lot of people seek out mental health support and services, so much so that every time we offer service, support services, it would be filled up, for spots would be filled up in less than 24 hours. The awareness is already achieved, I think. And now this next stage is we have to deliver interventions, and we don't have enough, there's no way of getting enough counselors and clinical psychologists to combat the problem. There's too many people and too little therapists. And so the best way we can do this is to help the existing therapists by automating, as I said earlier, automating all the technical aspects of psychotherapy. So there's so much work in just scheduling, screening, identifying symptoms through patterns. And these things can already be collected and analyzed with advanced technology like AI, digital phenotyping, and so on. So that is more of the healthcare intervention. Maybe you would like to talk a bit about social interventions that may be more pertinent. Okay, so many of the strong determinants of mental health is obviously social, such as your socioeconomic status, your parents' marital status, your employment status, your gender, your education level. This means that any successful social policy will help improve mental health outcomes as its third or second order effects. Genetic and your physiological factors are more costly and difficult to treat, but actually the most prevalent forms of mental health conditions, such as today, are actually moderate to low levels of anxiety, depression, and stress, which can be reduced with improved quality of life. So what kind of policies could improve quality of life? This could be improving urban landscapes, because this could mean improving employment access, childcare support, and traffic congestion, employment inequality. Not to simplify it, but better quality of life leads to improved well-being, which is so intuitive, it's almost a moot point. But all of this in the end affects people's mental health.
Are there any specific kind of social determinants of mental health that are specific to younger people? I mean, you listed a whole slew of things that go into our mental health and mental well-being, but for young people in particular, are there interventions that we can target to improve the mental health of young people?
So as mentioned before, like childcare support, that limited childcare support because of two-income households in the modern age leads to neglect, child neglect, or even child abuse in some cases because of financial difficulties that may cause added stress to the family unit. And of course, this directly impacts the child because the child is mostly affected by the family unit. So any improvements in policies that target family units and childcare support and mothers and women will eventually help children directly.
Right. You mentioned a bit earlier that you think we're there when it comes to public awareness about mental health. On the same coin, but on the other side is the stigma around mental health. Do you think that we have effectively addressed the issue of stigma around mental health the same way we have normalized talking about mental health, awareness of what mental health entails?
No, so based on some studies, there are still prevalent stigma, especially in certain communities. However, this is something that is too much of a challenge because even in developing countries, reduction in stigma is so hard to achieve because it means policing people's minds and people's speech. And as much as we can enact policies in order to do that, again, it's very challenging. And sometimes maybe it isn't necessary in order for people to privately seek out treatments. It's also not necessary in order for us to improve their quality of life through improvement of social welfare support. So for example, if we say, okay, we want to improve employment access for women in order to reduce their mental well-being, it doesn't require us to reduce the stigma around mental health.
Right. So I'm not. So in your work, Farihin, do you look at other countries and how they approach mental health from a policy framework? What are you seeing? What do you think Malaysia could learn from?
So we basically look at different frameworks by the World Health Organization, by UNICEF, and so on. So they set the bar, and they also have different frameworks for developing countries and developed countries because the needs are so different. And so some of the things that Malaysia can learn from, of course, is more systematic school-based interventions that go beyond, again, awareness campaigns. So very structured programs that actually improve students' quality of life. So those things are already being implemented in the US, for example, very successfully. But again, it's so hard for us to say that, oh, we should be like this developing countries because we have our own unique sets of challenges. So as much as we want to learn, we also need to sympathize with Malaysians.
Farihin, thank you so much for being on the show with me today. That was Farihin Ufiya from the Mental Health Aid Association, better known as Nyawa, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.